to a new report by the Prevent Cancer Foundation, 65% of Americans 21 years of age and older say they're not up to date on their routine cancer screenings. We've been telling you about this one. Jody Hoyos, CEO of the Prevent Cancer Foundation, is joining us now with some more insight into this report. It really is eye-opening. Jody, good morning to you. Tell us more about these numbers, the findings, and who you surveyed.
Oh, good morning. Happy to do that. It's a really important message, and we appreciate you sharing it. So, when we conducted our survey of about 2,000 people across the country, we found that people were better about their routine car maintenance, like oil changes, than they were about their routine screenings. And because routine screenings are so critically important for your health, so they can both help you to prevent cancer altogether or detect it early in its most treatable stages, we wanted to make sure we understood really what was going on, why people were missing their screenings, and how we could help turn that around and make a difference and get people the information that they needed.
Well, let's talk about the why, because we know during the pandemic, a lot of this went unchecked and people were neglecting their health and not going into offices, also economic issues. But what reasons did you find for this now that it's the post-pandemic era?
Right. So, even though we've moved on past the pandemic, there are still some people that cited fear of exposure to COVID as a reason for why they're not getting their screenings and avoiding medical offices. But it's not the biggest reason anymore. So the biggest reason people cited was they actually just didn't know what cancer screenings they needed. And many other people also reported that they didn't think they needed to be screened because they were not experiencing signs or symptoms.
So does this come down to not having a primary care provider, or is it that primary care providers are neglecting to get their patients these cancer screenings? What is the breakdown there?
So there's many factors, as things often are in healthcare. So one of them is that there's about 40% of people that reported that they were not having conversations with their provider about the screenings they need. So sometimes it's just not happening at all. Other times people are receiving a lot of information. So a lot of information is being pushed out at people. It can be confusing, it can be complex, it can be contradictory. So part of it is just making sure people have what they need in an easy to use format. And the other is encouraging people to talk to their providers themselves. So arm themselves with the information that they need so they can raise the conversation if it's not happening the other way around.
And what is your advice in less than a minute to people watching who are thinking, maybe I haven't been screening the way I should?
It's time to check. So be proactive about your own health. Early detection equals better outcomes. So the earlier you know about something, the more options you have. So I would go to preventcancer.org, take a look at the resources. There's an interactive tool there where you can create a personalized screening plan that you can print out, take it with you to your provider's office, and have a conversation about what you need, about your family history, and about what screenings are important for you.
This is really important, and it was a very eye-opening survey. Jody Hoyos, thank you so much for joining us. We appreciate your time this morning.
You're very welcome. Thank you.